there we are live.
We're live, and it's Suzilla. Welcome to Suzilla live from the Suzie Health Solutions office in Wenatchee, Washington, where we are the Enrollment Center for the Healthplanfinder of Washington State.
So we're gonna be doing a back to insurance school special.
That's true. Not insurance, but school starts in about 2 weeks around here.
Yeah.
My high school student goes back on the 24th. Other kids are in that same time frame, depending on what school they're in, what school district they're in, et cetera, et cetera, et cetera. But it's going to be that time of year again.
Yeah, and we're going to start seeing our first parents roll in with the panic of, what happened to my Apple Health? I need my kids to get sports physicals.
Well, we know that in the middle of October, they've extended the Apple Health coverage.
They've extended the Apple Health coverage since March of 2020.
Right. They've basically just been rolling you over regardless of your income status.
And they pulled some people who have increased in income back into Apple Health just to provide that extra stability.
Right.
Yeah. So October 13th is going to be the big day of whether or not they're going to extend it another 90 days.
Right. They may take it all the way out to the end of the year. They may not. We're prepared for whatever happens.
Yeah.
So here's the scoop. If you are one of those, what happened to my Apple Health, blah, 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 people, don't hesitate to ask.
Yes, correct.
They're going to give you a 60-day notice. They have to by law.
Mm-hmm.
So just watch your mail, read your mail, file your taxes. Those are always the number one and number two things around here. But yeah, back to school time, which means A, sports physicals. B, my kid's going back to college. How am I supposed to keep him insured, her insured, them insured?
Yeah, in-state's pretty easy. If they're not making any income, it's
Apple Health.
It's usually Apple Health. Yeah. And you want to get a plan that's specific to the area.
Yeah, that's really important. Now, one thing that can get a little tricky is if you are claiming them on your taxes still.
Correct, or if you want to have them in your household.
Exactly.
We've seen that one. And it's one of those ones where we got to, pinpoint, okay, where's the school at, and either what plan will work best at school and when they come home.
Exactly.
And that can get kind of tricky.
It can get tricky, especially since so many of these plans are either HMOs or EPOs, or they're just not.
Which brings me to one of those questions.
Yes.
Because I've been the last couple months, if you might have, I've been floating on Reddit, and because there's just so much bad information out there.
It's amazing how much bad information is out there.
And one of the things is where can I find, help for health insurance? And the good question, the good answer in Washington State is we have enrollment centers.
Right. Us and about 9 other.
Yeah, I'm not sure if they got Olympia back up and running.
But there's different insurance companies or different insurance brokers, different navigator groups. A lot of people who are dedicated to helping the citizenry of Washington State. And
we literally have got people from Sequim to Spokane, and almost all points in between.
That's true. Well, we are pretty much all the way across the state. A couple of gaps in Colville. If you're in Colville and you need health insurance, call me. Yeah. You could be my first.
So, yeah,
that came out weird.
We've got a big spread, and we answer a lot of different questions. Health insurance is broken down on a county level.
Yes, and most people don't understand that because a lot of people have worked with employer plans, which...
Well, no, employer rolls up as, here, this is the best we can do.
Yeah, exactly. But they're not, their HMOs are not normally, or if they're an HMO, they're not normally broken down by county. They are broken down.
Yeah, and we've seen some weird ones with ones. For instance, we're in Central Washington. We've seen, employers try to pawn off a Kaiser plan on their employees. And Kaiser's not in our area.
Nope, it does make it tricky. There's ways to work around that kind of stuff, but it's not fun. And it's a lot of mail order for prescriptions.
Well, one of the big things is employers need to get a little bit savvy. Yeah. And it takes a little bit of education, and that's why we're having insurance school. Because
that's all back to school thing.
That
was not the direction I was anticipating.
I know, surprise. It's always that first day is always a surprise.
I know, first day of school is always surprising.
So yeah, we're you want it's based on a county level, and the main reason behind that is for a insurance company to be in the area, they have to have a contract with like 20% of the providers.
Right, a pretty goodly amount. They got to be able to. If you get on a contract in the area, you got to be able to provide someone who will provide care. And if you can't get that 20%, then you don't belong there.
Yeah, and there's been a historic. I know there's been a couple cases where insurance companies have kind of stretched that little thing, and the insurance commissioner has slapped their little hands, and they've improved. We're going to see more of that.
More of the hand slapping, more of the improvement.
More of the improvement. For the first time, CMS and their little rules thing is actually starting to look at wait times.
The amount of time between your appointment
between calling up and saying, "Hey, you're seeing my primary care," or "Hey, you're seeing a specialist."
Because we're seeing really egregious wait times,
and some of that, and a lot of that has to deal with doctors and nurses and just having people.
Yeah. They're significantly understaffed in some spaces.
Well, some spaces are understaffed. The other is rural hospitals, not necessarily in Washington State. There was a couple in danger, and I know like Yakima got a loss, and it's because the actual facility has left.
Oh yeah, there's no one in the area.
Yeah.
And the rural hospital just picks up and says, "We're broke. We have to shut down."
Yeah, and a lot of that happened in the states that didn't expand Medicaid,
right? Because
they didn't have anyone to pay, so it's like, okay, yeah, just pay the bill, so we're out of here. And that's one of those important things. Doctors have got to get paid,
right? They make a living too.
Yeah, they make a living too.
To feed.
So when you start looking like fee for service models, it's really the rural hospitals just that gets blown apart.
Yeah.
You can't run a rural hospital or a rural emergency room on a fee for service level.
Well, what happens is people roll in the emergency room. They don't have health insurance. They can't pay for it, so the facility eats it.
The facility eats it, and they pass it on with taxes, or they pass it on by upcharging the paying customers.
Exactly. And it's very difficult to stay afloat. If you've got Medicaid, then you've at least got something coming in, usually.
Correct.
Even if it's not the full fee, it's something.
And one of the things we've seen from a small group standpoint, which kind of fits into that niche, there's a carrier out there that's offering kind of this non-negotiated rate. They pay like Medicare rates plus like 30%.
Yeah, which is kind of interesting.
Which is a really interesting model, and that's the closest I've seen on a large scale for that universal health care.
Yeah, I guess you could look at it that way.
They do if a provider does do balance billing, there's some negotiation in there with the carrier.
Explain balance billing.
Balance billing is where the provider, the doctor,
or the
facility, looks at it and said, "Oh, well, the insurance company and the co-pays aren't paying enough, so we're going to upcharge it."
Yeah, we're going to tack on an extra fee. And now they passed a bill recently to make those fees transparent.
Correct. They've been working on doing the transparency.
It was the surprise billing.
The surprise billing. Yeah.
Because that was a big sneaky thing.
Well, yeah, it's kind of terrifying when you take an ambulance ride for like $10,000.
Ambulances are a totally separate monster.
Yeah, thanks, Reagan.
Well, they're So you can't really use an ambulance as an example because they're usually private carriers.
Some are, some aren't. Some are contracted, some are not. It's really a kind of a.
It's a crapshoot.
It is a crapshoot
because you never know who you're going to get when you call 911.
And like our state Medicaid plans, those actually cover those really well.
Yes, they do. However, your individual plans less so.
Yes.
Medicare does a pretty good job, usually with a if you've got original Medicare And Medigap, you're fine. If you've got a Medicare Advantage, it's usually some $100 fee.
Yeah.
Either way, cheaper than a full cost, right?
Yeah, that's one of the things. It's like, what's the alternative for not having insurance? Well, you pay out of pocket.
Yeah.
And paying out of pocket is, if you have a major medical incident,
forget it. You might as well just file bankruptcy.
Well, no, you can't bankruptcy medical records.
Well,
you can, but it's really a nightmare.
Yeah.
B, if you've got things such as rental properties, they're going to come for those first.
They're going to take all of they're going to drain your assets before. So it's always good to have that stop loss out of pocket maximum.
Yeah, the out of pocket maximum.
Health insurance.
But let's get into Apple Health, because there are some big changes with Apple Health.
Yes.
First of all, there is help out there. You get we call the scary letter.
Yeah, that's a good one.
You don't understand. This is one of our general rules for our agency is you get a letter from the insurance company or a correspondence that you don't understand or ticks you off, you call us.
Yeah.
We'll figure it out together.
Exactly. We will help. We will help interpret the letter.
Yeah, because it's insurance-ease.
And we've seen most of them.
Yeah. And
if we don't understand it, we know who to call.
Yeah. And that's one of the things is that's why it's important to select. I tell people, hey, select a navigator that'll help. B, select a broker that'll help.
Right.
Those two are your front lines.
We are your health insurance team.
You don't have to use them, but if things go sideways, you've got some assets.
Yes.
So Apple Health is going to do some changes this next year.
Mm-hmm.
One of the big things that's going to change is the Apple Health and Homes Act.
Yes, and that's for some reason they're just not talking about that.
Well, they're not talking about in our area.
Oh, where we need it the most.
Where we need it the most. Now, well,
that's not entirely true.
We have anywhere that you got a homeless population, you've got people that do have chronic medical conditions, and they have chronic homelessness.
Yeah, they have a tendency to run hand in hand.
And they have a tendency to run hand in hand. So what the state legislators did is say, okay, let's do this. Let's get some of these folks some housing. So they can also work on their health issues. Right.
If you are not worried about where you're going to sleep at night, you can start considering things about. Well, okay, when you're in a houseless situation, your first thought is, where am I going to sleep? How am I going to stay out of the heat? How am I going to stay out of the cold? Basic, how am I going to feed myself today?
Yeah.
When you have got those worries allayed, then you can say, okay, my foot hurts. Oh, look, it's a giant red ulcer. I should probably have that looked at.
Yeah.
You start looking at the second tier of important stuff. Because usually if you're in a houseless situation and you have a medical crisis, it's got to be something big enough for someone to call an ambulance for you.
Yeah, so they're looking at taking care of some of that homelessness. So that's one of the first big changes coming with Apple Health.
Potentially huge.
Now so the next thing that Washington state legislators have really tacked on, and I want to address, is the $35 insulin.
Right, that's been all over the news.
Well, see, it's been all over the news.
From a federal standpoint.
For the federal standpoint, because there was a group of senators that said, hey, we're not going to do $35, we're not putting a price cap on insulin for the health plans.
Right. That was going to be a federal regulation, and it was going to be passed. It was. Now,
years ago, and let's I have to put this up because I keep seeing this one come up. During Trump's administration, he did a $35 cap for some Medicare plans.
Correct. The Medicare plan. Yeah, not every Medicare plan is required to be participating in that. But I think all of them have to have at least one plan that does.
Yeah. So I have to say some Medicare plans.
Right.
Now, the next layer of misinformation that was pushed out there was that Biden stopped that, and that the price of insulin shot up.
That's not what happened.
Correct. What Biden's administration did is say, hey, let's take a look at this, and it still is going to this day. If you are a diabetic on Medicare, without $35 insulin, you need to be talking to someone.
You need to shop. Yeah, there's no logic behind that.
Yeah. And then,
and hey, by the way, that $35 continues through the donut hole.
Yes.
You might go into the donut hole, but you're still only going to pay $35 for your insulin.
Talk to an actual Medicare
Talk to someone who knows what they're doing about Medicare.
And that's important. So what our state did early on this year was they dropped the $100 because we had a $100 cap on plans down, and they said, okay, next year we're going to do a $35.
Right. So
it's just for next year.
Oh, I didn't realize there was
they put a 1-year time cap on it.
Oh, are they giving a chance for the feds to do their part?
They were doing a chance for doing the feds because that was originally in the Build Back Better Act, which got squashed,
and now they're parting it out.
And so the Washington State says, okay, we're going to hold the line here.
Mm-hmm. We're going to be a good example for the nation.
Yes.
All right. So in the event that we don't get a federal action for the 35 after this whole rigmarole,
after this year, hopefully our state legislature will
either
step
keep it at 35 or the worst case scenario go back to the 100.
I don't know if the 100 had a time
limit. I don't know.
That's a problem with certain legislations having time limits.
Yeah.
Is some legislations are not forever.
Mm-hmm.
One of the talks, and this is an important talk, is turning all federal legislation to a 5-year.
Yeah, I've heard about that, but that could get tricky.
Yeah, that was done by on the Republican side. It was the Scott, the senator out of Florida, his proposal.
Mm-hmm.
And there's been talk from a couple of the other Republican senators that they want all federal legislation to run on a 5-year renewal basis.
Well, that gets tricky unless I suspect though, if you do like a constitutional amendment, that's different.
That's different because that's a constitutional amendment. But these are laws. This would impact Social Security,
mm-hmm.
which is an insurance, your Medicare and your Medicare program.
Yeah, they could easily just quash all of these major programs.
Well, they would get it. The big thing is, from what we've seen, is one group would band together and block any effective renewal.
Mm-hmm.
A good example of this has been the CHIP program.
Yeah.
Because that was one of the things that we were hoping to be put on the permanent list.
Mm-hmm.
It was in the Build Back Better originally as part of the permanent program list.
Mm-hmm.
It's what it does is, for the CHIP program, is it provides health insurance for working families.
Mm-hmm.
And that is incredibly useful because instead of paying full out of pocket price, they said, okay, hey, for either a no fee or a nominal fee like $20,
mm-hmm.
Kids will be put on Apple Health, which
right.
is our state's Medicaid program.
Right.
So it's been an awesome program in making sure that kids are insured.
You start off on the right foot.
Yeah, because in that program, if they're on Apple Health, if it's medical necessity, kids could get braces.
Mm-hmm.
And that's an important thing, is that they can get their teeth taken care of. They can start out, age 19 with the medical bills taken care of.
Well, yeah, they're not coming, and they're going into adulthood healthy.
Yes, and that's incredibly important. Hopefully, we'll see more legislation to make that program permanent, because we're on those. It makes sense to have programs permanent, because here's the thing: if they income out, well, they got a safety net to fall into, but they're not needed, so those dollars aren't spent.
Right.
That's the big caveat with any of those social safety net programs, which brings us to tax credits.
Right. The advanced premium tax credit has had a temporary reprieve.
Yes. What happened was the American Rescue Act in 21,
mm-hmm.
March 21, passed and said, hey, you know what? We need more people insured. Let's lower the rates by putting together some enhanced tax credits and so that no one pays more than 8.5% of their income.
Right. So people who maybe had not been getting tax credits because their income was too high, suddenly were getting tax credits. People who had been getting some tax credits were getting more tax credits. People who are getting a bunch of tax credits got a ridiculous amount of tax credits.
Yeah, I think what was the most one you did for someone? Now this is someone that's over 60.
Yeah, it was like $1,200 difference.
Yeah,
it was ridiculous
per month.
Saved a big bunch of money, and they were able to put money back in their pockets to get them through COVID.
Yeah, it puts money back in the family's household so that they can do things. And yeah, it was through COVID, but it's just money back in American families' pockets.
And and as a result, back in the community.
Yeah. And that's, it's like, oh yeah, hey, suddenly they found out that, hey, I can afford to go out to eat once a week.
Mm-hmm. Well, here's the thing. With inflation doing what it's doing right now, having money in your pocket of any sort is huge. Every dollar back in your pocket that you're not having to spend on something is going to make a difference in what you can buy at the grocery store, or if you need to buy a new refrigerator or, a new blanket for your bed, little things like that.
Last month, the inflation was flat.
That's good.
Inflation, traditionally, consumers have more money in their pocket than there's goods available. Okay. That's the easiest way to define it. You're not going to, with that model, you're not going to see corporations with record level profits. We saw corporations with record level profits. That means some of those old models and that old inflation numbers are really pushing the definition of inflation.
Mm-hmm. All I know is it seems like the prices of at least groceries has gone up.
Oh yeah, we know that. Some of that supply chain issues, some of it is corporate gouging. Mm-hmm. I wish that there was some more legislation to address that. Even most recently, we heard from the Idaho Attorney General saying, "Hey, well, what about this price gouging for gas?"
Because they were price gouging.
Because we rolled through Idaho.
We drove from Washington to Oregon through Idaho. And we thought, when we get to Idaho, their taxes are lower, their gas prices should be lower. They were actually a little bit higher.
Yeah.
So it wasn't taxes. It was gouging. They were gouging because the cost of a gallon of the wholesale cost of gas doesn't really vary that much from state to state.
Yeah.
I'm a little bit like in the Gulf states because they don't think it goes far, but there was no excuse for it to be, it was good 15, 20 cents higher in Idaho than it was here in Central Washington.
Yeah. So it's one of those.
That's gouging.
It's not only gouging. It's relying on that reputation that it's going to be lower. Mm-hmm. And I've seen this before. Is people get this kind of a brand idea.
Okay.
That something's going to be cheaper or more affordable. And one of the good examples of that is I've had friends that have shopped at like Walmart. Mm-hmm. Oh, the prices are great.
Yeah, but you get less stuff. Low quality.
And you always want to shop for value. Mm-hmm. And that's one of those important things. So be more mindful of where you shop, because those traditional ones, if they ever queue up that, hey, this is cheap or this is awesome, that's about the time when some of those mustache twirling CEOs do something horrible for the consumer.
Yeah. One of the things I noticed, one of the first times I noticed what Walmart's model was I don't remember why I was there, but I was looking at hot dogs.
That's a long time ago.
It was a long time ago. Because I don't normally shop there. And that might have been when they were just starting to do groceries here at our local store. Mm-hmm. When you go, this was, I don't know, 10 years ago, 15 years ago, 20 years ago, however long ago.
We've been hanging out over 20 years, so it's before my time.
Yes, but either way, a traditional package of hot dogs was 16 ounces, 1 pound.
Yeah.
And you'd pay, 99 cents for it if it's the cheap stuff, the bar S, right? So I was trucking on down. Oh, hey, here's Walmart. Oh, hey, it's like 79 cents. It's less expensive. It's 12 ounces.
Yeah.
Yeah. It was the first example of shrinkflation I'd ever seen. Mm-hmm. You're paying less, but you're getting less.
Yeah, it's that whole situational awareness.
Mm-hmm. And that's just you just got to be aware of it. And if you only want 12 ounces, fine, save the 20 cents.
Mm-hmm.
But if you really want to feed your family, 99 cents for a pound of hot dogs ain't too shabby. Mm-hmm. Of course, you can't get that anymore, but it was a nice thought 20 years ago.
All right, so we're still back to school. Let's we did $35 initially. We did Apple Cascade Care Savings.
Oh yes,
Cascade's Care Savings is a huge program. We actually are in a special enrollment right now.
Yes.
If you don't have health insurance right now and you're making less than 250% of poverty level, you can get enrolled.
For one person, that's about $32,000.
Correct. It's a little over $32,000. $32,000 is a great.
$32,200.
Yeah. Yeah. It's
I saw the chart yesterday.
Yeah. So yeah, you can, if you don't have healthcare, that's why everyone that comes in, it's like, yeah, we're going to run an application and see where you land.
Something might happen.
Correct. And then we tell people, always run the application. Don't do that. Well, how much does it cost if I pull the magic lever? We run it. We see if the worst push comes to shove, you're set up for November 1st.
Exactly. Here's the deal. When we just set up an application, there's never an obligation.
Yep.
You're not getting obligated to do anything. You're not going to get spammed by the state for this. You're not going
to spam by us for it.
Well,
we don't sell it. We're going to talk. We're going to talk to you. We're going to send reminders. And it's always going to be about insurance. We don't sell it to third parties.
No, we will not do that ever, ever, ever. That is against our mandate.
Well, it's against our mandate. We've been around for quite a few years. Now, one of the important things is the Medicare change for advertising.
Yeah, the Medicare's got some new rules.
It's got some new rules. For example, when we talk about Medicare or Medicaid, all phone calls are recorded.
Correct.
We've already done that to our system, just point blank. And we don't know if we're going to be talking about Medicare. We don't know if we're going to be talking about Medicaid. We just blanket it all. It goes in your file.
Confidentially.
We've got some lockdowns for that because information is confidential. Well, that's a good example. We had to put some caveats on our website and literature saying, hey, we're not going to talk about all plans because there are some plans that do not contract with agents.
Right. If you want to know more about it, we'll take it to Medicare.gov, which is a tool I usually use anyway, but it's just, this is more flexible. So
yes, there are some changes out there. The good players will be following the rules. The bad players will not.
Yeah.
It impacted, out of like the 64 million, there was like 37,000 complaints. So we're talking less than 1%.
Yeah. They're the guys who don't want to change.
Yeah. So and it was probably some bad call centers out there run by, out of a different country. Or the bad mailers that we've seen.
Oh my gosh.
Yes. In Central Washington, there are some shifts in Medicare Advantage plans. You want to talk to someone. There's stuff that's been filed. We don't know if it's been approved yet. We won't know until October 1st. We won't be able to make changes until October 15th.
Right. We are restricted to talking about this stuff even.
So
don't ask.
Well, no, it's just really simple. If you're going to ask or say, hey,
let's make an appointment.
Let's make an appointment. And that's the important thing is we know that there's changes. We know that there's questions happening. And if you can't get into some of those backwaters and say, well, what's the insurance rate's going to do or what company is going to be available, set the appointment.
Exactly.
We have folks, because of technology and who we are, we have folks that are furthest out Medicare appointments so far for when they're turning 65 is 5 years out.
Yep.
If they keep their cell phone between now and then,
they'll get a reminder.
They'll get a reminder say, "Hey, it's time to talk to Suzie about a
Medicare appointment."
Medicare appointment.
Yep.
So that we have no problem setting appointments out further.
Nope.
And answering those questions. If you've got questions about, "Hey, I'm going to retire next year," we're going to tell you what's going on. because we know what we've got. We understand the system. We can walk you through it, and it's like, okay, this is when you want to set the appointment, and we can start making those steps.
Exactly. You can lay some groundwork,
and we can lay some groundwork.
That's what the fun part about summer is. It's like all that groundwork.
Mm-hmm. So hey, if you got any questions, give us a call. If you don't have insurance, give us a call. Or talk to someone that's local.
Mm-hmm.
I can't stress it enough. Talk to someone that understands your local situation.
Exactly.
That's trained. Oh my gosh, please talk to someone that's trained, not your dumb uncle.
Yeah, we run into some dumb
we run into dumb uncles on a regular basis. Like, no, that hasn't been that way for a decade.
A decade or so, yeah.
Insurance is law driven. So yes, things can change. We stay up on it the best we can. Mm-hmm. We're going to see, continued low rates. They're going to be lower than what they were 3 years ago for most people.
Yeah.
That's without a doubt. So if you haven't priced insurance within the last 2 years,
come take a look.
You really need to take a look because your situation has changed. Mm-hmm. Okay. So, hey, everyone, have a great day. We are out of here for today. Like, share, have fun, and we will be talking with you later.
Bye. Bye.